2 Americans are now infected with the Ebola virus, which has killed more than 670 people across several West African nations. The news this weekend has been grim. The deadly disease has now crossed borders and has reached Nigeria, the continent's most populous nation. And the Sierra Leone woman, the first to have contracted the disease in the capital of Freetown, has now died. Dr. Amar Safdar is an infectious disease specialist, and he joins us here in our New York studio. Also, we have Ken Isaacs, who is the vice president of Samaritan's Purse, the aid organization associated with the 2 American victims, and he joins us from Boone, North Carolina, and is on the phone. Are you there, Ken?
Yes, sir, I am.
Okay, thank you so much for being here with us. I'm going to ask you if you'll stand by for just 1 second. Dr. Safdar, let me ask you just a couple of foundational questions.
Sure.
You know, the truth is every medical professional puts themselves in harm's way when treating people who have infectious diseases.
Yes.
But give me an idea, Dr. Safdar, of the precautions that these medical workers needed to take to protect themselves and what went wrong in these 2 cases.
Sure. Thank you for having me. So this is a highly contagious infection. There are several other infections that we commonly encounter, like influenza. The less common here, but more common in developing countries, are tuberculosis. So there are several infections that can be easily transmitted from person to person. The unusual thing about these hemorrhagic fevers, including Ebola virus disease, is it is highly contagious. But it is not airborne usually. It is contagious by coming in contact with infected fluid. So that could be vomiters, blood, and so on and so forth, saliva. And that contact could be on the intact skin and mucous membranes, including eye. So if some fluid is splashed in the eye, that certainly could be a route to get infected from this virus. How are they being protected? Healthcare providers and healthcare workers is by wearing this a fairly strict and well put together gear, protective gear, with a head shield and an apron. And it is not an easy thing to wear, just because it's an easy thing to wear to start with, but it is even more difficult because how hot it gets in the tropics during the summer and humid conditions. The breach probably occurred where there was an unintentional encounter with the infected body fluid. But we don't know the details.
Right,
obviously.
in this case, something went wrong because there is gear there to protect the medical professionals. Ken, let me turn to you now and just ask you, first of all, have you gotten any word on how Dr. Brantley is doing?
Well, Dr. Brantley is in serious but stable condition. He is alert. He is in pain. He's resting. He's isolated. Of course, we also have Nancy Wright-Bull. She is about in the similar condition. Both patients can ebb and flow. They can get a little better, then they get a little bit sicker. But we started intensive supportive care right away. There was an early diagnosis. They are not out of the woods yet. But we hope and pray that they do survive.
Is it the goal of Samaritan's Purse to get them to a point where they can get them out of the country, or do they have to be nursed back to some sort of reasonable health before they can be moved?
Well, it is not our goal to take them out of the country. If there's a number of problems with that, but I think primarily evacuation would need to be made from a medical perspective, and it's generally accepted that the stress of travel would overcome any potential benefit of an advantageous healthcare system.
I know this is alarming to you and for all your colleagues there. Has there been any discussion about pulling aid workers out of the country? Is this a cause for alarm?
Well, as the doctor was explaining, our medical staff follow the procedures of the Center for Disease Control, World Health Organization, and Doctors Without Borders, which is probably the most experienced organization in the world, and they have worked hand in glove with us the whole time. But the doctor is correct, there was a breach, and that is how our 2 team members became infected. We did find that breach. It was not in our procedures and in our protocols, but it was actually in an individual, a national staff person, who reported to work and was positive. And that staff person died on Thursday, and we believe that the exposure to our two staff happened either on Monday or Tuesday during the decontamination process.
Wow.
So but we're taking other protocols and putting them into place now, including checking people's temperature before they can come into work. And it's been a real blow to the staff.
Well, I'm so sorry to hear about the fatality, and our thoughts and prayers are with Dr. Brantley and the other medical professional, Ken Isaacs. Thanks for joining us on the phone. Dr. Amar Safdar, thank you for being here with us.
Thank you very much.
Appreciate it.